Hi, my name is Joe Newtoff, and today we're going to be talking about joint mobs, applying grade 1, 2, 3, and 4. We're going to start off by talking about the tibial femoral, and then the second MCP joint, and then we're going to go to the glenohumeral joint. To start off, first, grade 1 application, grade 1 application of the tibial femoral joint. We're going to apply some traction downward to try to open up the calf space more. And with the grade 1, it's just at the beginning of joint play. So we're going to pull down and just do back and forth, anterior and posterior. Small amplitude, and this will help with pain. Grade 2 is similar, traction down, and it's at small amplitude to the middle of joint play. The resistance is the ACL and PCL. And then grade 3, you apply a larger amplitude, and it's middle to end range of joint play. And that's for increasing tissue mobility. And then grade 4, it's a smaller amplitude, but you need a greater force to get it all the way to full end range. And you'll feel the ACL and PCL click for anterior and posterior directions. Now, if you look at it between the knee and then the second MCP joint, the knee is clearly much bigger, so you need more force applied to really try the increase in mobility and increase the mobility and like healing. So again, when we do it, the grade 1, 2, 3, and 4 to the MCP joint, since it's smaller, we do not have to apply much force at all in the beginning. Grade 1, again, is the beginning of joint play, small back and forth. Grade 2 is a larger amplitude to the middle of joint play. Grade 3, middle to end. And then grade 4 is end to end, clearly with a smaller amplitude, but it's a full range of motion. Again, since it's a smaller joint, you do not have to apply as much force to get the benefits of it. But if we look at the shoulder next, it's a much more mobile joint. So we have to hold, stabilize, and then traction down because we want to clear that coracoid process. And again, it's much more mobile because it's like, if you think about it, it's like a golf ball sitting on a tee. There's not much resistance going on, so you don't have to apply as much force. Again, with grade 1, it's just traction down, and it's the beginning of joint play. Nice and easy, small amplitude. You might have to apply a little bit more force because, again, it is a bigger joint than compared to the MCP. Grade 2, we're just gonna, it's to the middle of end range. Again, larger amplitude, and this will also help decrease pain. Grade 3 is middle to end. This will it's a larger amplitude and it will increase tissue mobility. And then grade 4, pull down, and it might not feel comfortable for the patient, but it's going anterior and posterior, and you pull down to clear that coracoid process. And it's smaller amplitude because you were going end range to end range motion to also increase tissue mobility. And that's all.